Okay, let's talk about medical ministry. We're going to talk about how the health message and in particular the health work relates to the church, how it relates to the gospel, the different types of health work or different schools of thought regarding treatment of disease, and then the different types of education we can have in this field. Well, two main types we're not going to go into everything. So, health and the church. What is God's promise concerning sickness and disease? In Deuteronomy 7:15, the Bible says, "And the Lord will take away from thee all sickness, and will put none of the evil diseases of Egypt, which thou knowest, upon thee, but will lay them upon all them that hate thee." So in other words, God said He will take away all sickness from His church, and He will put none of the evil diseases of Egypt upon those of His church. Now, did God's people in fact receive this freedom from sickness and disease? Well, in Jeremiah 8:22 we have the well-known phrase, "Is there no balm in Gilead? Is there no physician there? Why then is not the health of the daughter of my people recovered?" Well, God's people, we should be the healthiest people on earth, but we're not. I spent some time at someone's place, and when I woke up one morning, I went out to have breakfast. The older guy was there as well, and in front of him for his breakfast, he had all these different types of pills. One for heart problems, a blood pressure pill, and then all the pills to treat all those side effects. And I thought, wow, this is a member of our church, and we're relying on all these pills. Well, sometimes they're necessary, but I was thinking, this isn't God's plan for us to wake up in the morning and eat a lot of pills for breakfast. And the same thing happened, same principle when someone I know got a cancer on their head, and not necessarily a member of our church, but closely associated with a member of our church. And they went to the doctor, the medical doctor, and they said, yep, it's cancer, we're going to have to operate, surgically remove it, which they did, and it looked all good until the skin around the wound started becoming all puffy and losing sensation, and it seemed like an infection. So this person went to the hospital or to the doctor, and they confirmed, yes, it was infected, but not just with any bacteria, it was with a superbug from the hospital. So now the person had to have these extra strong antibiotics to combat the disease caused by this hospital bug. And I was thinking at the time, well, this person's being cut open to remove the cancer. They were given antibiotics as general practice when you undergo surgery. They became infected with a disease from the hospital itself, and then they had to have extra strength antibiotics, which are even more harmful to the body, in order to combat the superbug that this person received from the hospital. I was thinking, and the same thing, I thought, this is not God's plan. This is not God's plan for His people, that we should be suffering not just from disease, but also from the medicine. So why is this the case? Why do we have a prevalence of disease in the church? Why do we have all the diseases of Egypt within our membership? In Exodus 15:26, God gave the condition. He said, "If thou wilt diligently hearken to the voice of the Lord thy God, and wilt do that which is right in His sight, and will give ear to His commandments, and keep all His statutes, I will put none of these diseases upon thee, which I have brought upon the Egyptians, for I am the Lord that healeth thee." So the condition is for the freedom from disease is that we must diligently hearken to the voice of the Lord thy God, and to give ear to His commandments and His statutes. So it goes, you can assume then, if we keep the commandments, we have no disease. Therefore, if we have disease in the church, it's possible that this can be caused from not keeping the commandments. In other words, not living up to the light that we've been given in health reform. If we met the conditions, the promise would be sure. However, if the promise is not sure, if we're not seeing the fulfillment of the promise, the possibility is that we are not meeting these conditions. Jeremiah 46:11 says, "Go up into Gilead and take balm, O virgin, the daughter of Egypt. In vain shalt thou use many medicines, for thou shalt not be cured." So I mentioned it before, we've become dependent upon the healing principles of the world. The practice of depending upon medicines and drugs in order for the treatment of disease, as opposed to naturally overcoming disease through the strength of nature with that God works through in the body. So when this person got the cancer on their head, I was thinking to myself, wouldn't it be great if we had an institution, an SDAM institution, where we could go for healing for various problems like this? Well, especially in Australia or New Zealand. I mean, I'm pretty sure we have some sanitariums in Brazil and maybe Romania and Philippines. We have a lot of clinics. Not too sure about sanitariums. But wouldn't it be nice if there is a place that we can attend when someone in the membership is sick? We do not have to be dependent upon the worldly medicine, but we can go to a place where God's order is followed. But we don't. The sad fact of the matter is, when the Seventh-day Adventist Church began and they established these institutions, they had amazing institutions. We all hear about Battle Creek, but if you look at some of the old magazines, and they've got advertisements for these different institutions all over the country, and it's really nice institutions. And now, what has happened to this? Why do we have nothing now? We have the Seventh-day Adventist Church. They have their hospitals for sure, but we don't see these natural retreats where we can go that are operated through the Seventh-day Adventist Reform movement. In this country anyway. In other countries, sure, there might be some. And even if there are some, there's not a prevalence that we need in order to meet the demands of the sickness in our membership. So what does God desire for His church concerning medicine? In Deuteronomy 28:13, God said, "The Lord shall make thee the head and not the tail. Thou shalt be above only, and thou shalt not be beneath." Now, the Seventh-day Adventist Church used to lead the world in medicine. If you think about that for a second, the church was the head of the world. All the breakthroughs were coming through the Seventh-day Adventist Church. The world was far behind it. The allopaths, the ones that would bleed you and cut you and give you nasty chemicals in order to treat your sickness, they were years behind the Seventh-day Adventist Church. But now, what do we have? Are we the head or the tail? Well, if we're relying upon the world for our treatment, then we are obviously not the head. And if people are not coming to us for health, but we are going to them, we're going to the world, it makes us the tail. But it doesn't have to stay that way. What is God's plan for health and the gospel? In Matthew 4:23, we know that Jesus went about all Galilee, teaching in their synagogues and preaching the gospel of the kingdom and healing all manner of sickness and all manner of disease among the people. So with Christ's teaching, He incorporated healing directly. There was a direct connection between preaching and healing. And in Luke 9:26, when He sent forth His disciples, we read, He sent them to preach the kingdom of God and to heal the sick. So the gospel message is a healing message. It is the health message, as we all call it, the right arm of the gospel. And in Jesus' time, Jesus Himself incorporated healing into His preaching, and He sent His disciples to do the same, to preach the kingdom of God and to heal the sick. And in Luke 9 verse 6, what did the disciples do? They departed and went through the towns, preaching the gospel and healing everywhere. So Jesus preached and he healed. He sent his disciples to preach and to heal, and they preached and healed everywhere. A very close connection between healing and preaching. Now, why did God choose health or healing to accompany preaching? This is found in letter 10, 1886. A godly physician can drop into the heart seeds of truth which may spring up and bear fruit to the glory of God. Grief concealed from others may be expressed to the physician. Then is the opportunity to point them to Him who has invited the weary, the oppressed, the very ones whose soul is aching for their loved ones. What an opportunity to propose a word of prayer, which will not occupy more than 3 minutes' time, presenting them to the healer of all woes, the soother of all sorrows. The physician who pursues this course can accomplish more than the minister in the pulpit. So the physician who has an opportunity to meet someone at their lowest and point them to Jesus can accomplish more than a sermon from the pulpit. Obviously, it's better to have a minister who operates in medical lines, but if we're just talking about the method itself, the physician has a greater opportunity to reach the heart than a sermon from the pulpit does. And that's because the person who's at their lowest point is also the most receptive. What if medical work is not included in the gospel ministry? This is found in Testimonies, Volume 6, pages 240-241. Medical missionary work is in no case to be divorced from the gospel ministry. The Lord has specified that the two shall be as closely connected as the arm is with the body. Without this union, neither part of the work is complete. The medical missionary work is the gospel in illustration. So notice this sentence here. Without this union, that's union of gospel ministry and medical work, without this union, neither part of the work is complete. So if you exclude medical work from your gospel ministry is not complete. And if you exclude your gospel ministry from your medical work, then your medical work is not complete. So the union requires both the gospel and medicine. As society declines, what will be the only ministry left? I wish to tell you soon that there will be no work done in ministerial lines but medical missionary work. This is found in Counsels to Health, page 533. So when evangelism is official or eventually outlawed, hate speech laws and all this, the church, having no doctors and no institutions, has no hope of finishing the gospel call. If we have no doctors and no institutions, we have no hope of finishing the gospel call, because the only work to be done in ministerial lines in the end time will be medical missionary work. So let's talk now about God's plan for medicine. What are the systems of medicine that were in existence in Ellen White's day, and I believe are still in existence today? This is found in Manuscript Releases, Volume 20, page 373. When the great question of health reform was opened before me, the methods of treating the sick were plainly revealed to me. The old school cruel practice and the sure results, where one claimed to be benefited, thousands were made lifelong invalids who, had they never seen a physician, would have recovered of themselves without implanting in their system diseases of a most distressing character. Eclectic was less dangerous. So I know it's a long passage, but just look at the first sentence. She's saying that the methods of treating the sick were plainly revealed. And then she talks about two different methods of treating the sick. The one is the old school cruel practice, and the other is eclectic. The former one, the old school cruel practice, was where thousands are made lifelong invalids, or they suffer a disability because of the medicine. And the eclectic system is less dangerous, according to the revelation of the Lord. So what is the cruel nature of the old school practice? This practice where thousands are made invalids, where if they'd never seen a doctor, they would have healed, they would have overcome the sickness naturally. So what is the nature of this practice? This is from the same manuscript releases, volume 20. Quote, "I told Dr. Maxon we did not erect an institution at such immense cost to have people educated to resort to drugs, but to instruct them how to cure without drugs. I told them what the Lord had been pleased to show me nearly 30 years ago in regard to the old school practice of drug medication upon the miserable wrecks of humanity made so by the use of drugs. So the nature of the old school practice is drug medication." Now, the word allopath or allopathy, this comes from two words really. I think it's Latin. Allos, meaning opposite, and pathy, meaning sufferings. So sufferings can also symbolize symptoms, like for instance homeopathy, that homeo means same and pathy means suffering, so you treat the symptom with the medicinal tonic that causes those same symptoms. But in allopathy, you treat the symptoms with a medicine that has the direct opposite effect on the body. So if, for instance, if you have a fever, the medication will be one of, instead of heating the fever, would be one to lower the fever. Or if you have high blood pressure, the medication is one in which it lowers the blood pressure. The opposite to the pathy or the suffering or the symptoms. So just getting over the nature of the old school practice that we talked about, who's damaged thousands upon thousands, is drug medication, and we also know it by the word allopathy. So what type of drugs are we talking about here when we're talking about drug medication? Some people will say this is talking about frogs' livers, snake oil, all these weird and wonderful toxic concoctions that we used in the past, but now we have improved so much today that we don't use these crazy inventions anymore, concoctions. We use scientific drugs, right? This is still from the same manuscript. "But there has been positive harm done by the strong doses of medicine given by Dr. Maxon. Such enormous quantities of quinine given to his patients, which he maintains is far better in influence than less." So quinine may cause serious and life-threatening bleeding problems. In some cases, kidney injury can also occur. This is found in drugs.com. It's still used today. I think it's a malarial drug now, and also probably used in other instances. But the idea is the same. The principle behind the large doses of medicine in allopathic hospitals are the same that they've always been. Back in Dr. Maxon's day, enormous quantities of quinine were given to his patients, and Sister Ellen White, through inspiration of the Holy Spirit, said that there has been positive harm done by these strong doses of medicine. And it's the same medicine is still being used today. So what is the leading cause of medical injury today? Is it maybe a botched surgery? For instance, you've heard of, I know a gentleman actually in the Coromandel who, he had a catheter in one of his veins, I believe, and in removing it, they slipped, or they made an accident, and he actually lost all use of his leg. I think it was his left leg. And then we were visiting him for a couple of years, and then I think a couple of years after that, he had another operation, and they had another medical misadventure, and they had to remove his leg actually. So twice he was injured by the surgery itself, and he ended up losing his leg because of it. But is this the leading cause of medical injury? The surgery going wrong? Maybe it's hospital infection, like the superbug I told you about earlier, or even an infection resulting from surgery. Would that be a leading cause of medical injury? How about misdiagnosis, when a patient is considered to have one disease and they're treated for that disease, but it is not the disease that needed to be treated, and it has an adverse effect on the patient? Well, actually, no, none of these are the leading cause of medical injury. The leading cause of medical injury today is an adverse drug reaction. They're also called ADRs. In other words, when you have a reaction, a bad reaction to a drug. And just to put into perspective, this costs around $50 billion a year worldwide, adverse drug reactions. Cost the in the medical organization, I don't know, it doesn't cost them so much, but it causes $50 billion worth of injury. And I think there are about 2 million injuries per year of these ADRs, 2 million ADRs every year reported in the United States. And actually this accounts for 20% of all morbidity and mortality. 20% of all medical related problems as an ADR. So what are the 3 most dangerous drugs then? Opioids, of course. We know that there's an epidemic in the United States and probably in most countries now with the addiction and overdose and progression from opioids to heroin and like narcotics. Terrible drug, terrible problems with it. Anticoagulants, for instance, you have warfarin and other blood thinners and different medications that prevent the blood from clotting. There's a second most dangerous, second leading cause of adverse drug reactions is from an anticoagulant. For instance, you have bleeding problems. And antibiotics are the 3rd most dangerous when you have problems with your kidneys, your livers, different organs of the body. So let's look at a few very common drugs. And just because people assume that all these are very safe and they're very mild sort of drugs, because we're talking about these are household drugs that you can buy in the supermarket, most of them. For example, paracetamol, that actually can cause liver damage. By the way, this information I got it all from my university lectures, so it's not something you read on a website blog or anything. This is from the data, but just condensed. So we have liver damage from paracetamol. Aspirin, it affects multiple organs and especially the GI tract. On aspirin itself, I think it's Bayer is the producer of aspirin, and they produce around 100 billion tablets per year. 100 billion. This equates to about 35,000 tons of tablets are produced every year. And when you're thinking about a little tiny tablet and you have 35,000 tons of those tablets, that's a lot of tablets going out into the population every year. Somebody is taking a lot of aspirins, and I can tell you it's just about everybody. The older generation, especially when they started on aspirins, it was like you have a very common thing for someone just to take an aspirin for everything. So people everywhere in Australia, New Zealand, especially the United States, are all taking aspirin, but it's actually a very dangerous drug. And now, if you read the label on an aspirin, it'll say, in quotes, "Unless a doctor has told you to, do not use this product in children under 12 years of age or teenagers with chickenpox, influenza, or fever." So now they're giving a warning on the label not to give it to children under 12 years of age. Why? Because it is has very serious consequences to the organs of the body, especially on a younger person or a teenager even with a disease. So very terrible product, but still being sold in its thousands of tons. Ibuprofen causes kidney. I can't quite remember, but I'm pretty sure that this is done by a substance within the ibuprofen precipitates in the kidneys. In other words, it forms crystals, and these crystals damage the kidney tubules. So yeah, it's direct damage to the kidney, ibuprofen. And Vioxx, which is used to treat arthritis, I think. That's toxic to the heart, cardiotoxic. And they did a study, and they found that Vioxx itself had a 400 times had a 400% increase in myocardial infarctions, that's heart attacks, or when heart tissue dies, compared to other drugs. It's 400 times, causes 400-fold more myocardial infarctions or heart attacks than other drugs. It's terribly toxic to the heart. And I've got here amoxicillin, but we're just talking about penicillins or the derivatives in general that can cause anaphylactic shock or any disease on the anaphylactic spectrum. And obviously because penicillin and the derivatives like amoxicillin represent yeasts or molds, and the body has an allergic reaction to that, and it causes the immune system of the body to have a very severe reaction, and which can be even life-threatening in some cases. So it's not a good idea to put poisons within your body, or even foreign microbes. So why is the allopathic system then, with all these dangerous drugs and with all the bad history behind it, why is the allopathic system leading the world? Why is the SDA Church in union with the allopathic system? And here's why. In letter 88, 1889, Dr. John Kellogg has said to us frequently, "Send us your young men to learn to become doctors, and we will do the best we can for them." But these men come out fully fledged allopathists and deeply set against any other manner of practice. So the reason why the allopathic system is leading the world is because the students are trained to be set against any other manner of practice. The allopathic system is the holy grail, and anything else is quackery, as we can see in the next quote here in 16th manuscript releases 16, page 288, quote, Dr. Kellogg, "God has given you favor with the medical fraternity, and he would have you hold that favor. But in no case are you to stand as do the physicians of the world, to exalt allopathy above every other practice, and call other methods quackery and error." Because that's what they do. If you talk about any aspect of natural healing today with a medical doctor, they will scoff at you. Well, I'm not saying all medical doctors, but a lot of them will, especially the students. They will scoff because they've been taught in the medical schools that they are the only scientific and the only true method of healing the sick, and everything else is quackery and error. Again, I have been shown that there have been large numbers of deaths and a greater number of sufferers left upon the earth to drag out a miserable existence under the allopathy practice than under the other methods of treating disease. But like Sunday keeping, its age and name has stood as the only true scientific method of treating disease. So that's why it's leading the world. It's because the students are trained to consider all other methods as quackery and allopathy or drug medication to be the only true scientific method of treating disease. And that's the problem, and that's why it's leading the world, because the vast number of medical schools are all promoting this practice of looking down on other methods and exalting allopathy as the only true method of healing. So what's the nature of the eclectic system then? That's the old school practice, drug medication, allopathy. What's the nature of the eclectic system that Sister White mentioned in the first quote? So she says in 20 MR, "I told him of the two systems. The old school system had killed its thousands and its tens of thousands, while the eclectic, or as he called it, homeopathy, had done no such dangerous work or deadly work." So the two systems she's talking about, the old school and the eclectic. She makes a reference here to homeopathy. We'll come back to that. Dr. Gibbs is not a homeopathic physician, but he takes the good of all. He obtained his education in the regular school and has his diploma from that school. So an eclectic method of practicing medicine is to take the good of all. In fact, that's what eclectic means, is to select the best methods in order to produce the desired result. You take the best of everything. When she says he's not a homeopathic physician, it's because in the early days of probably even into the 1900s, people who practiced natural methods of healing were often called homeopaths. But there is a distinction here between practicing natural methods like Dr. Gibbs, he'd taken the good of everything, and others who were only homeopathic physicians which only treated every disease with homeopathic remedies. So Sister White's saying Dr. Gibbs, he's not one of these who only have this one line of treatment, which is homeopathic tinctures. That he is an eclectic physician where he takes the good of homeopathy, he takes the good of allopathy, he takes the good of natural methods of healing, and he combines them all. He's an eclectic physician. So what's the secret of success of those practicing the eclectic system? After the whole system of drug medication had been laid out before me, I was shown of God that we should have an institution conducted on hygienic principles, and in that institution lectures should be given not on how to use drugs, not to lead minds and educate them in the methods of drug using, but to teach people the better way to live healthfully and to do without drugs. The words were repeated: educate, educate, educate. So the secret of success is an institution that's conducted on hygienic principles. We'll come back to what they are in a second. And it's to live without drugs, do without the drugs. What type of medical system does God desire his people to operate under? My spirit is stirred within me when I see the efforts made, even among our people, by professional men to cry down and demerit every medical practice in the treatment of disease except the one method of allopathy which they have learned. I will not fall into line with this thing, but I will say in the name of the Lord, let the drugs fall into disuse and practice upon hygienic principles. It's not in God's order to educate people to depend upon drug medication. Physicians who believe present truth need to make advanced moves in reform. So she's saying the medical system that is under God's order is to educate people to not depend upon drug medication, but to practice hygienic principles. So pretty much repeating what we just said. Now the question then should be, should I become an MD? Should I study at an allopathic institution? Well, there could be. Remember Dr. Gibbs, he was just I made mention of, he was the eclectic physician in the previous passage. He studied at an medical school, an MD medical school. So should we encourage our young people to study MD medicine? The problem is, as found in letter 88, 1889, there ought to be far less drugs used, and all who practice as physicians who have received their diplomas from the allopathy institutions do not receive at the same time the right mould after God's order. There is altogether too much strong medicine used. So while we do have exceptions like Dr. Gibbs and others, Sister White here is saying, under inspiration, that those who attend these allopathy institutions do not receive the right mould after God's order. So they go in maybe with a good heart, seeking to learn how to treat the sick, but that in doing so they receive the mould of the medicines of Egypt. So what was James White's greatest fear? And he wrote in Life Sketches 248, my life has been given to the upbuilding of these institutions. It seems like death to leave them. They are as my children, and I cannot separate my interest from them. If the great adversary can mould these institutions according to the world's standard, his object is gained. Evil influences must not prevail. I rather die than to live to see these institutions mismanaged or turned aside from the purpose for which they were brought into existence. So his greatest fear was that Satan can change the Adventist institutions to be according to the world standard, to operate under the world standard. And he said that if Satan can do this, then his object is gained. Why? Because he would have destroyed the purpose of these institutions, of the natural methods of healing that they used to operate under. Has Satan done this? Well, in the SDA church, if you go to an SDA hospital, I've been to a couple, not all of them. Maybe there's some out there that are operating under hygienic principles, although I doubt it. Just about all of them operate in the same way. You would not know the difference between a Seventh-day Adventist hospital and a hospital from the world, maybe except for the lunch menu. They might have more vegetarian options. But other than that, very similar practice, as far as I'm aware. So what kind of doctors does the world need today? She wrote in 1889, "Give us good, conscientious, working men and women upon hygienic principles and put out the drugs. In accordance with the light God has given me, we must never cease reforming." So these two things that we've been talking about time and time again, hygienic principles and doing without drug medication. What are the hygienic principles we're talking about? Well, look at this in Ministry of Healing. This pretty much sums it up, in my understanding anyway. In case of sickness, the cause should be ascertained, unhealthful conditions should be changed, wrong habits corrected. Then nature is to be assisted in her effort to expel impurities and to re-establish right conditions in the body. Pure air, sunlight, abstemiousness, rest, exercise, proper diet, the use of water, trust in divine power, these are the true remedies. So just these 4 points here in the start of this quote. When someone is sick, there's 4 things you have to do. First, you have to establish the cause. The cause should be ascertained. Why is this person sick? Second, the unhealthful conditions should be changed. And third, wrong habits corrected. And then fourth, nature is to be assisted. And that's, for example, through botanical medicine, herbal remedies, juicing, all these other sorts of ways that we can help nature to expel impurities. And we know the true remedies, we just list them as the 8 laws of health. So, in ascertaining the cause, this is Ministry of Healing 235. The first thing to be done is to ascertain the true character of the sickness and then go to work intelligently to remove the cause. If the harmonious working of the system has become unbalanced by overwork, overeating, and other irregularities, do not endeavour to adjust the difficulties by adding a burden of poisonous medicine. So when establishing the cause, we have to understand why the sickness has come about. Is it because of the diet, maybe? Is it because of the lifestyle? Is it because of somewhere in the 8 laws of health there's an irregularity which is causing this person to become sick? Then instead of prescribing medications to treat the symptoms, we should be first correcting the conditions, changing the habits, and then helping nature to expel the impurities. So when we're thinking about this is very different than the system of the world. This is a very different method of treating disease. There's no way you can go to an MD and have him tell you you're not getting enough sleep, or you're eating your meals irregularly, and therefore you need to change your habits of eating in order to fix your disease. It's not going to happen. He's going to give you a pill. 9 times out of 10 problem. No, some MDs are good. I know that some MDs, for instance, my uncle was given a discounted gym membership because the MD wanted to get him exercising, which was a big part of his problem. But in the end, he still prescribed the pills as well, so the exercise didn't happen, but the pills did. So, treating the cause is the issue, and we want to learn how to do this professionally. But where can I go to learn this treatment of the sick? For instance, when we're talking about back in 1888 or 1889 and later, when we had the big Seventh-day Adventist institutions who did operate on the hygienic principles, we did have a place to go to study. But now as a church, I don't know of any medical school within the church within the SDAM especially, I don't think there's any. Now we have a lot of naturopath medical schools. I don't know if you call it, where people can train to become naturopaths or herbal doctors or whatever you want to call it. But in a sense, it's it is definitely a good thing. But is it the full extent of the education that we require? So let's talk now a little bit about medical education. What are the two types of postgraduate medical schools available to students? So we have a lot of graduate medical schools where you do a 3-year course or a 4-year course and you become a naturopath or a massage therapist, or I think a homeopath is a longest duration of study, but it's another one. But we were talking about medical schools themselves. To become doctors, what are the available medical schools? We have allopathic medical schools where you become an MD, and we also have what's known as a naturopathic medical school. So this is not the same where you go to an undergraduate tertiary institute and obtain a bachelor or certificate in naturopathy. Naturopathic medical school is a medical school, and they train students who already hold an undergraduate degree, just like allopathic school, MD schools do, and they train them to be naturopathic doctors, not naturopaths. So let's look at the two, allopathic versus naturopathic medical schools. Now, the focus of treatment in an allopathic medical school, they major in medicative treatment of symptoms, which we've talked about, using drug medication to treat the symptoms. And they also employ surgery or surgical treatment of the symptoms. Where on the other hand, naturopathic medical schools teach to treat the cause. They then teach different modalities where you can assist nature to heal from the disease. They teach lifestyle, and nutrition is a big part of healing disease, and also the connection between the mind and the body, stress and related problems that we inflict upon our minds, which have result in the disease of our bodies. Now, the minor focus of an allopathic medical school, they have the lifestyle, nutrition, they'll have mind and body relationship, and the minor focus of naturopathic institution is medication and symptom management and minor surgery. So you can see here the complete opposite. The medical school, the MD medical school, will focus on medication and surgery, while with having a minor approach to lifestyle, nutrition, mind and body, whereas the naturopathic medical school will have a major on lifestyle, nutrition, mind and body, treating the cause and healing assistance, and it will minor in things like medication, symptom management and minor surgery. Now let's look at getting into a medical school, whether allopathic or naturopathic, MD or ND. Both need biology, as I think probably a year of 2 semesters of biology. That's talking about anatomy and physiology in your undergraduate degree, your Bachelor of Science, whatever you did. Both require you to have general chemistry, organic chemistry, biochemistry, physics, mathematics, English and humanities, and the MD medical school requires you to sit an MCAT exam, which the naturopathic medical school or the ND medical school does not, but does require you to take other courses like psychology as well. So you can see here the actual courses are very similar in order to enter into an MD medical school as they are to enter into an ND medical school. Very similar requirements. And they both require you to have a minimum GPA out. I think because of the competitive nature of getting into an allopathic medical school, their GPA requirement is a lot higher than the naturopathic medical school is, because there's not a lot of people who want to become a naturopathic doctor. There are a few thousand, but the majority of people go to be an MD. So let's look at the actual medical education itself of both schools. In years 1 and 2, both schools study biomedical science, clinical sciences, diagnostics, and they both have an exam at the end of the second year. In the medical school, MD medical school, it's USMLE. In the ND medical school, it's NCLEX exam. Years 3 and 4, very similar again. Not They start similar, but this is where they really diverge. Both study pharmacology, both study nutrition, although an MD studies a lot less nutrition than a naturopathic medical school will provide you with. And conversely, an allopathic medical school will study a lot more surgery than a naturopathic medical school will. And both study clinical training, but the allopathic medical school will train you in the operation of a hospital, or generally you'll do rounds in a hospital for your clinical training. And in naturopathic medical school, you do have rounds in the clinic, but it's more focused on utilizing these hygienic modalities such as hydrotherapy or massage, even chiropractic, homeopathy, all these different types of healing assistance. And they both finish with an exam, USMLE exam in the MD school and an MPLEX in the naturopathic school. Both have residencies, but the naturopathic medical school, the residency is optional, whereas in the allopathic medical school it is required. So let's look at the actual class time, the clinical hours, and the residency of both schools. In the allopathic medical school, you spend about 2,600 hours in class learning from the book, whereas in the naturopathic medical school you have about 3,300 hours. So it's about 700 hours more in the ND medical school of class time. However, when we're getting into clinical training, we have about 2,200 hours of clinical training in the allopathic medical school, and we have about 800 hours less of clinical training in the naturopathic medical school. It's because you don't operate in a hospital, you operate out of a clinic as a naturopathic doctor. So you have a lot less training in terms of clinical duties. Residency, normally for an allopathic medical school, for an MD, I think for it to become an MD, you need to have complete a 3-year residency. I think for surgery it might be 10 years or something like that. Whereas in naturopathic medical school, it's entirely optional, and generally you can even get a 1-year residency from a naturopathic medical school. So now I'm going to give a few charts that just display a little bit of information about and comparing the types of education within both medical schools. This is from 2016 calendars of different medical schools, and just focusing on the MD and the ND. The MD were taken from Yale School of Medicine, very popular school, and the ND from Boucher Institute of Naturopathic Medical School, Naturopathic Medicine in Canada. I didn't do these graphs. This was done, you can see at the bottom there, prohealthsys.com. But they've taken the data from different schools and they compile these charts. So you can see here on the left, we've got MD versus ND in the middle. Total hours 4,800 for the MD and 4,748 total hours for the ND. If you look in red, that's the number of academic hours. You can see the ND has more academic hours, whereas the MD, the medical doctor, has more clinical hours in the blue. Talking about the education itself, when we're comparing MD and ND, looking at just purely anatomy and physiology, both MD and ND study anatomy and physiology, obviously, but in both cases, ND actually have more hours devoted to the anatomy and the physiology. Just in case you're wondering, DC is Doctor of Chiropractic and DO is Doctor of Osteopathy, which both have very high hours of anatomy because obviously chiropractic and osteopathy deal fundamentally with structures of the body, so the bones or the muscles, the spine, so on. So they have a lot of hours devoted to learning the different parts of the body, anatomical parts of the body. But in both cases, ND, naturopathic doctor, has more education concerning the anatomy and the physiology. Looking down at diagnostic imaging, like CT scans or X-rays, different imaging procedures, the MD actually has more hours devoted to the study of diagnostic imaging than an ND does. And again, you look up at chiropractic and osteopathy, they both have more than both MD and ND because that's how That's the basis of their method of treatment. Orthopedics, ND outshines MD by a lot. Then we're going to looking at soft tissue mobilization. I'm guessing that's like massage. MD, of course, has none, and ND, naturopathic doctor, has about 60 hours training. And it's very similar with rehab and exercise educational hours. ND has 36, MD has nothing. DPT here, that's just physiotherapists. You can see they have a huge amount of hours devoted because that's their niche of treatment. Osseous mobs, I think that's just bone manipulation. Chiropractic obviously has the most, but ND also has 80 hours and MD has none. And same with osseous manipulation, ND, but nothing for the MD. Going into nutritional and botanicals, ND has the most out of all the possible courses, 402 hours of nutrition and botanicals. And MD, they might have some, but it's so little that it's not even shown on the chart. Pharmacology, if you look in MD versus ND, they have very similar hours devoted to the study of pharmacology. Number of hours are very similar. Electrotherapeutic, that's like the e-stim machines where they send an electrical charge to stimulate the muscles, presumably to have a therapeutic benefit. You can get electric acupuncture, does the same sort of thing. ND has 36 hours devoted, MD has none. And going down to surgery, the bottom right there, you can see MD outshines them all. Well, it's very similar to Doctor of Osteopathy. 360 hours devoted to surgical training. ND only has 18. So there's the basic differences between the two medical schools. So if you're deciding with you have options when you're in our church, and you can become a medical doctor if that's your desire. You can become a naturopathic doctor. I wrote naturopathic doctor. It should be naturopathic doctor. And there's also options where you're not either a medical or a naturopathic doctor, but you can become a naturopath. There are places for all types of education within God's work. What would I recommend? Well, I wouldn't. I wouldn't recommend, because every person is different. Every person has their own path from God, so they each need to have their own understanding of God's will for their life. And I think there is great benefit in having a large number of people not necessarily training as doctors, but training as still receiving training in remedies, herbal remedies, massage training, nutrition, lifestyle counseling, all these sorts of things that do benefit society overall. For the doctors, it's very hard to come away from a medical school and completely operate under the facets of naturopathic medicine, or hygienic principles, I should say. But there are a good many examples of people who have done just that, who have obtained their MD, but then gone to operate as a naturopathic doctor, in a sense, operating under hygienic principles. But if you have the means and the courses available to you, I would recommend, if becoming a doctor is God's will for your life, I would recommend the naturopathic pathway myself, because it appears that the church led the world in medical education and medical operation, actually. But James White's greatest fear was that Satan was going to turn the operation of these institutions, medical institutions, to operate under the same principles as the world. And he's saying that if Satan could do this, and he's gained his he's gained his purpose. And I believe that's what's happened. As we can see in the Seventh-day Adventist hospitals around the world, they all operate under the same principles as the world. And even I've heard, I'm not too sure if it's 100% true, I've heard they even provide abortion abortion procedures in some hospitals. I'm not too sure if that's not verified, but I'm just saying the outcome of the Seventh-day Adventist health institutions is not a good one, and I believe that Satan has turned the operation of these institutions to the worldly mold. And I think, personally, I believe that God has taken the principles, hygienic principles that the church used to lead the world with, and he's given it to the world under the name of naturopathic medicine. In either case, if we're seeking to preach the gospel to the world, we need to have some sort of education on medical lines, because you cannot have a complete gospel message without the medical work, and you cannot have a complete medical work without the gospel message. So in either way, in any case, we need the wisdom. We need training in medicine, we need training in the gospel, and so education is the principal thing. Just to quote here from Proverbs chapter 4, verse 5 through 9 and 13. Get wisdom, get understanding, forget it not, neither decline from the words of my mouth. Forsake her not, and she shall preserve thee. Love her, and she shall keep thee. Wisdom is the principal thing, therefore get wisdom, and with all thy getting get understanding. Exalt her, and she shall promote thee. She shall bring thee to honour when thou dost embrace her. She shall give to thine head an ornament of grace, a crown of glory shall she deliver to thee. Take fast hold of instruction, let her not go, keep her, for she is thy life. We need to have an education. What that education is between you and God, but I pray that we as a church can really seek out education and medical lines, and that we can really give the gospel message with its right arm to the world. I'm going to leave some resources down below in the description, so please feel free to have a browse. The AANMC website obviously has a lot of information about naturopathic medicine, since it is the Association of Naturopathic Medical Colleges. But there's a couple of interesting videos. If you're looking at, I like debates. I find that you can get a lot of information from a debate, as well as an answering to very common objections. So the naturopathic medicine debate, it's an old one, but it's a good one. You'll see it there. That's Andre Sains versus, I forget his name, Strauss? I can't remember. But anyway, it's a good debate. And the same too, debating at homeopathy, which is another interesting debate. If you've probably heard a lot of bad things about homeopathy, you should watch that one. So thank you very much for listening. I hope this has been helpful and useful. May God bless us all in seeking to do His will and for His work.